Mr. Kohler, please read the title of House Bill 1160.
House Bill 1160 by Representative Lontine, all Senator Tate, concerning continuation of the Surgical Assistant Surgical Technologist Registration Program.
Representative Lontine.
Thank you, Mr. Chair, and I move House Bill 1160 and the committee reports from Health Insurance and Environment and Appropriations.
To the committee report, Representative Lontine.
Thank you, Mr. Chair. So, in Health Insurance and Environment, we added 2 amendments.
Appropriations report.
I was just told there is a specific order. So, the appropriations report basically appropriated the cash funds for the bill. I asked for an aye vote.
Is there any discussion on the Appropriations Committee report? Seeing none, the question before us is the passage of the Appropriations Committee report. All in favor, please signify by saying aye.
Aye.
Nays?
Yes, you do.
The ayes have it. The Appropriations Committee report is adopted. To the Health Insurance and Environment Committee report.
Thank you, Mr. Chair. So in the Health Insurance and Environment Committee, we added 2 amendments. The L007 was a requirement for employers who require applicants for employment to submit to a drug test and then forwarding any such tests that are positive to DORA. And the second amendment was to add a background check for our all of our current registrants and new registrants for this coming year, and then in the preceding years for any new registrants and those who let their registration lapse with CBI and FBI. And those are the committee reports. I asked for an aye vote.
Is there any further discussion on the Health Insurance Committee report? Seeing none, the question before us is the passage of the Health Insurance Committee report. All in favor, please signify by saying aye.
Aye.
Opposed? The ayes have it. The committee report is adopted. To the bill, Representative Janal.
Thank you, Mr. Chair. I move House Bill 1160 to continue registration of surgical assistants and surgical technicians. Employers must report to DORA when they terminate or discipline a surgical assistant or technologist, and DORA can then discipline or revoke a technologist or assistant's registration to ensure that he or she does not place patients in jeopardy at another facility. Registration provides a mechanism for employees to file complaints against surgical assistants and technologists with DORA. Employees are more likely to file a complaint against a fellow employee at DORA than at a facility where they are both employed. The DORA Sunset Report revealed that the majority of disciplinary actions against surgical assistants and technologists were based on alcohol and drug-related offenses. Drug-addicted healthcare workers can spread infections like HIV and hepatitis C, and alcohol and drug abusers are often impaired on the job, which can harm innocent patients. During the 4-year registration period in which DORA reported, the DORA director prevented 7 surgical assistants and technologists from being registered due to substance abuse and addiction, drug theft, falsifying painkiller prescriptions, and the risk of being under the influence on the job. An additional 5 applicants were placed on probation due to their DUI or to a DWAI conviction. A surgical assistant or technologist is present at hundreds of surgeries each year. These are professional people, folks, and keeping these surgical assistants and technologists out of operating rooms and away from Colorado patients means tens of thousands of patients were kept out of harm's way. It only takes one to infect many. And I just want to add that the Association of Surgical Technologists, the Association of Surgical Assistants, as well as many other organizations like the Colorado Medical Society, support this bill. So I ask for your support and a yes vote on House Bill 1160.
Is there any further discussion on House Bill 1160? Seeing none, the question before us is the passage of House Bill 1160. All in favor, please signify by saying aye. Opposed? The ayes have it. House Bill 1160 is adopted.